Good afternoon, everyone. My name is Michael Hermes. I'm a financial advisor at Haran, and I have on the line with me as well my colleague Nate Epp. Today we're going to spend about an hour and a half or so talking about how you can navigate Medicare and Social Security. And so I will spend the first 45 minutes or so discussing Social Security and everything you need to know there. And then Nate will follow up afterwards to speak towards Medicare. But once again, my name is Michael Hermes. I'm a financial advisor. I'm a certified financial planner, chartered financial analyst, and national Social Security advisor. And so we have a lot to get through today. And so with that being said, I'm going to just go ahead and jump right in. And so if you've ever worked with a financial advisor before, one of the things that you want to make sure of is that you're working with a fiduciary. So I like to start all my presentations with this. And so essentially what a fiduciary is whoever you are working for has to make sure they have your best interests in mind when giving you financial recommendations. Not every financial company has to operate as a fiduciary, so if you are working with an advisor, make sure that you ask if you are working with a fiduciary. So really what a fiduciary is if you were to go shopping for a new suit or dress, if you were a regular financial advisor, which that term is pretty loose, but if you are a regular financial advisor, they just have to make sure that suit or dress fits you. As a fiduciary, I also have to make sure you look good in that suit or dress. And so that's really the main difference of what a fiduciary is. And so at Haran, all of our advisors here are fiduciaries. A quick way of knowing if you are working with one is if they have the letters CFP after their name when you get their business card. So CFP stands for Certified Financial Planner. So with that, there's about 9 different topics that we'll be speaking to today with Social Security. The first is, will Social Security be there for you? You hear a lot about how the system's going bust, and so we'll debunk that myth just a little bit. How much you can expect to receive from your benefits, when you should actually apply for Social Security, how you can maximize your benefits and different strategies you can utilize. If you have a non-covered pension, like for example in Ohio, the most common ones are the state teachers retirement system or the Ohio public employee retirement system, how that could negatively impact your benefit amount, how your benefits are taxed, how you actually apply for your Social Security. Something new this year is how to designate a representative payee, that if you're to become mentally incapacitated, someone that can make Social Security decisions for you on your behalf. And lastly, how it all fits into your retirement picture. So will Social Security be there for you? That's a great question. And so you hear a lot about how the system's going broke, right? And I meet with a lot of individuals and they say, well, I'm not counting on Social Security because I'm not going to get anything because the whole system's going to go broke. And so every single year, the Social Security Administration releases their fiscal results. And so at the end of 2019, every single year, about $1.06 trillion comes into the system via taxes on your paycheck. And then every single year, about another $1.06 trillion leaves the system in the form of benefit payments. So at the end of 2019, there was actually a surplus of $2.5 billion. And that surplus goes into the Social Security Trust Fund, which sits there in reserve, earning interest, so that if there's no more surplus, Social Security Administration can continue paying beneficiaries their payment. And so the trust fund balance sits at about $2.9 trillion at the end of 2019. And so that sounds like a big number, right? But in the grand scheme of things, that's not very much. And so it's actually projected that this year, 2020, there's no more surplus. And so going forward, Social Security Administration is going to have to start dipping into that trust fund to continue paying beneficiaries 100% of their payment. And so without any sort of reform, it's expected that in the year 2035, that's when that trust fund is depleted to zero. So Social Security Administration can only pay out what they take in every year. And so everyone will get roughly 79% of their benefit amount in the year 2035. And so it is going broke, right? But everyone will still get a payment. It's just whether or not will it be 100% or will it be 79%. And so right now, once again, it's projected that in the year 2035, that trust fund is depleted to zero, and everyone will receive 79% of their benefit payment. So when we're doing Social Security forecasting and wrapping it into our clients' financial pictures, we like to discount Social Security by about 20% to take this into consideration. And so that's how the system stands currently, and there's still some time, right, to fix the system, and there's a lot of ways that the system can be fixed. And so right now in Congress, there's a bill. It's called the Social Security 2100 Act. If this bill gets passed, what it will do is extend 100% of your payment through the year 2100. So everyone will get 100% of their benefit payment through the year 2100. And so how are they planning on fixing the system, right? Really, it's twofold. The first is they're going to increase the amount that is of earnings that are subject to Social Security tax. So currently, the way it works is if you make more than $137,700, there's no more Social Security tax on your earnings. What they're going to do is that if you make over $400,000 per year, the Social Security tax will kick back in. Okay, so you have to start paying tax again. So that's the first way they're going to fix it, is increase the amount that's subject to tax. The second way is that they're going to increase the overall tax rate. So currently, both you and your employer pay a 6.2% tax on those earnings for Social Security. And so what they're going to do is they're going to raise that tax by another % for both you and the employer and phase that in over the next 25 years. So that instead of paying 6.2%, you're now paying 7.2%. So increase the overall tax rate and increase the amount that's subject to tax, and you've magically fixed the gap in the system. Okay, so that's what's currently in the bill. So just keep your eyes posted in the news for the Social Security 2100 Act. But with that being said, right, how much can you actually expect to receive from Social Security, assuming the system doesn't go broke? And so hopefully everyone on this call today has taken a peek at their statement before. And if you have, you would know it would look something like this. So this is the first page of your Social Security statement. And in the top right-hand corner, there's a big bold number. And that number is your personal retirement benefit that you are eligible to collect at your full retirement age, which we'll get into in a second. But how are they coming up with your retirement benefit amount? What the administration is doing is they are using the highest 35 years of your earnings history, plugging it into a formula, and out spits your benefit amount. Okay, so the national average Social Security benefits around $1,400 per month or so. And so, but the key to remember here is that they are using the highest 35 years of your earnings history. And so when you open up your statement and you get your statement and you flip it to page 3, it will list every single year that you contributed to Social Security and Medicare. Okay, so go through when you get your statement and open it up to page 3 and make sure it looks accurate. Okay, make sure you don't have any zeros in there for years you did in fact contribute to Social Security. The administration is about 99% accurate with the reporting history, which means they can mess up 1% of the time, right? And we've typically seen it happen to people who are ever self-employed. Okay, so make sure you go through your earnings history and make sure it looks accurate, and make sure you don't have any zeros in there for years you in fact did contribute to Social Security, because if you do, it will negatively impact your benefit. Okay, make sure it looks accurate. And so once again, they are using the highest 35 years of your earnings. And so if you are going through and counting up your earnings and you notice that you have 34 years contributing and you're contemplating working one more year to get that 35th year, I promise you it is not worth it. Okay, so the amount that you will actually pay into the system for tax versus what you'll actually get back out in benefits, you have to live to be age roughly 160 to get that benefit back. And I don't know about you, but I'm not planning on living that long. So go through, double check your earnings statement, make sure it looks accurate. So if you've never received your statement, you should be receiving your statement in the mail once you turn 60. And I've also heard that they might have turned this off, and so the only way to get access to your statement is via online. So go on to the Social Security website. If you haven't already, create a login And once you've created your login, you can go ahead and pull your statement at any time. So I would encourage everyone after this webinar today to go onto their Social Security account and pull their statement and get a better idea of what their benefit looks like and make sure that your earnings history looks accurate. All right, so when should you apply for your Social Security benefit? All right, so on the front page of your statement, right, on the top right-hand corner, there's that big bold number, and that's when you're eligible to collect 100% of your retirement benefit at your full retirement age, okay? And your full retirement age is determined based off of the year you were born. So if you were born between 1943 and 1954, your full retirement age is 66. And then they kind of stagger that full retirement age every 2 months if you were born after 1954. And then if you were born 1960 and later, your full retirement age is 67. Okay, so fun fact, when Social Security was first started, the full retirement age was 65, but most people only live to be 65 years old. Nowadays, the latest full retirement age is 67, and most people live to be in their early 80s. And so benefits are getting paid out a lot longer than what they used to. And so I wouldn't be surprised if in that bill they start to extend that full retirement age later and later to help with the system and the shortfall there. But the way it works right now, if you were born between 1943 and 1954, your full retirement age is 66. All right, so most people know this, but you don't actually have to wait until your full retirement age to begin collecting your benefit. The earliest you can apply to begin collecting Social Security is age 62. But each year you take it early, it's going to be discounted roughly 7% per year. Okay, so if you look in that middle column there, if your full retirement age is 66 and you apply for your benefit at 62, you're going to get 75% of your benefit. And once you've taken Social Security, you've taken it. That's the amount you're going to get the rest of your life. Okay? On the opposite end, each year you delay taking Social Security, not continuing to work, just delaying taking your benefit will increase 8% per year. So same thing as last time, if your full retirement age is 66, that middle column, and you wait until age 70 to begin collecting, you will get 132% of your benefit amount. I actually had a physician contact me one time. He was 72 years old. He said, Mike, when should I start taking my Social Security benefit? And I told him, well, you should have started taking it 2 years ago when you turned 70 because there's no more delayed retirement credits after age 70. So he actually called up Social Security, and the most that they would lump someone back was 6 months worth of missed payments. Okay, so he actually ended up missing out on a 1.5 years worth of Social Security. So never wait past age 70 to begin collecting your benefit. You don't have to wait the full year to get the 8% increase. So the increase does occur on a month-by-month basis. So if you wait, say, 66 and 6 months, instead of getting the full 8%, you'll get 4% increase instead. So when you get your statement and you open it up to page 2, it will list your age 62 amount, your full retirement age amount, and your age 70 amount all at the top of the page there. So you can get a better idea of what your benefits expected to be at those different ages. One thing to keep in mind, though, if you read the fine print on the statement, the numbers that they are showing you at age 70 and your full retirement age, they assume that you are going to continue to work earning as much as you are earning to those ages. So those numbers might be inflated just a little bit, okay? But just keep that in mind. So when should you start taking Social Security, right? 62, your full retirement age 70, sometime in between. You ask 100 different financial advisors and you'll probably get 100 different answers, okay? But there are some things to consider. Everyone's situation is different. Just because your friends or family did one thing doesn't mean that's what you should be doing as well, okay? So some things to consider. Your health status, right? If you don't think you're going to live very long, you'll probably want to go ahead and start collecting Social Security. Get as much out of the system as you can. Okay? On the opposite end, life expectancy. So if you do think you're going to live a long time and your family has good longevity, it might make sense for you to wait until age 70 to begin collecting. So for example, if you wait until age 70 versus taking it at 66, you're missing 4 years worth of payments by waiting, right? And so the break even on that is roughly age 81, 82. So if you think you're going to live longer than age 82, it would make sense for you more than likely to wait until age 70 to begin collecting your benefit. That third bullet point there is need for income. So if you're getting ready to retire and you don't have any other sources of income, probably need some money to live off of, right? And you'll need to start up your Social Security benefit. Number 4 is whether or not you plan to work. Okay, this is a big one, and we see a lot of people mess this up all the time. Okay, with Social Security, there is something called the annual earnings test. What this states is if you take Social Security before your full retirement age, okay, so 62, 63, 64, 65. So if you take Social Security before your full retirement age and you continue to work at your job, you cannot make more than $1,520 per month at your employer, or Social Security is going to withhold a portion of your benefit amount, okay? So typically what we see happen is you're 63 and you retire, and so you go ahead and start up your Social Security benefit, and so you took it early, and so you're not getting the full amount because you took it early, and then 6 months goes by and now you're bored, so you pick up some part-time consulting work, and you end up making more than $1,520 per month. And all of a sudden, Social Security stops sending you money in the mail. And you're wondering what happened. Okay, it's because you hit this earnings test threshold. So the way this works is if you are working and collecting before your full retirement age, you cannot earn more than $1,520 per month, or they're going to withhold a portion of your benefit. Okay? January 1 of the year you hit your full retirement age, that limit is increased. You can now earn up to $4,050 per month before Social Security begins withholding anything from your check. And then the month you hit your full retirement age, so for me, November 1st of the year I turned 67, there's no more earnings test. It goes away. So you can earn as much money at your career as you want and receive your full Social Security check. Okay? So this is why we encourage most people to wait until at least their full retirement age to begin collecting, so they're not subject to this earnings test anymore, okay? So if you do start taking Social Security before your full retirement age, just try not to make more than those thresholds, those earning thresholds, or make sure that you don't go back to work until at least your full retirement age, okay? Those numbers, that $1,520 per month and $4,050 per month, that is only on earned income through your employer or through self-employment. It does not include income from your investment accounts. If you're taking monies out of your IRA or 401k or 403b through your employer, that does not count towards that threshold. Any pension income, stock options, rental property, that does not count towards that. It is only earned income. Okay. And just to note, we will be sending out these slides afterwards, so everyone has a copy. So if you have any questions, please don't hesitate to reach out. We're about to get in some of the meat of the material, and so we don't feel like you have to walk away being an expert on these strategies. Just know that you have a resource that you can reach out to for questions. We do not charge to get together and just talk through your situation, okay? So this is usually the part of the presentation when I get to it. Most people say, no wonder the system's going broke. Okay, because there's a lot of ways you can file for benefits. Even if you've never contributed to the system before, you might be eligible for a Social Security benefit. And we're going to talk about some of those different strategies that you can utilize. Okay? The Social Security Administration, when you apply for your benefit, we like to say they are like drive-throughs. Okay? You go in, you tell them what you want, and hopefully they'll give you what you ask for. They are not going to make sure that you are using the strategy that is best for your personal situation. They are not financial advisors, okay? They are strictly order takers. So this first strategy that we're going to talk about, it's called the spousal benefit. So when you apply for your Social Security, and if you're married, you can get the greater of your benefit or 50% of your spouse's benefit. Okay, once again, you can get the greater of your benefit or 50% of your spouse's benefit. All right, so let's take a look at that example below. So Jane's PIA stands for primary insurance amount. It is Social Security's fancy way of saying the amount you are eligible to collect at your full retirement age, okay? So Jane's eligible to collect $2,000 a month off her record. Mike's eligible to collect $800 a month off his record. Instead of Mike taking his retirement benefit and getting $800 a month, he's going to apply for his spousal benefit and collect half of Jane's $2,000 and get $1,000 a month instead of $800. Okay, so he's just getting the greater of his retirement or half of Jane's. In this case, half of Jane's is higher than his retirement. And so a couple things about this. Mike could have been a stay-at-home parent his entire career. His benefit could be zero. He can still apply for 50% of Jane's benefit amount. In addition, this does not negatively impact Jane's benefit at all. She will still receive her full $2,000. The only difference is Mike is now getting $1,000 instead of $800. Okay. With the way Social Security works now, in order for Mike to apply for a spousal benefit, Jane has to be collecting her retirement benefit. Okay. So there used to be something called file and suspend. You can no longer do this, which would allow a spouse to collect the spousal without an individual having to apply for their personal retirement. But the way it works now is Jane has to be collecting her retirement in order for Mike to take the spousal benefit. Okay. Age 62, just like regular retirement benefits, is the earliest you can begin collecting a spousal benefit. But each year you take it early, once again, it's discounted by about 7% per year. So if you begin taking that spousal benefit at age 62, you'll get roughly 75% of the 50%. Or in this case, Mike would get about $750 a month instead of the full $1,000. Okay. On the opposite end, there are no delayed retirement credits with a spousal benefit. What that means is it will not increase 8% per year you delay taking it past your full retirement age. Okay. So if you're going to take a spousal benefit, you should pretty much never wait past your full retirement age to begin collecting it. Also remember that annual earnings test. If you're working and you decide to collect that spousal benefit early, you cannot make more than that $1,520 per month, or they're going to withhold a portion of your spousal benefit. And that annual earnings test will apply to all of these strategies from here on out. All right, usually when I get to this slide and I'm doing this presentation in person, I get a couple cheers in the audience. And so this next strategy is for divorced spouses. And so if you were married for at least 10 years and you are now divorced, you can get the greater of your benefit or 50% of your ex-spouse's benefit. Okay? Unlike last time, where I said Jane had to be collecting in order for Mike to take the spousal benefit, as long as your ex-spouse is at least age 62, and as long as you have been divorced for more than 2 years, you do not have to wait for your ex-spouse to begin collecting their retirement benefit. You can just go ahead and start up your spousal benefit. A couple tacky things about divorced spouse benefits. If I could have been married 3 times, all of which lasted 10 years or more, I could have 3 ex-spouses collecting off my record. I don't know what's happening, okay? It doesn't negatively impact my benefit at all, but I could have 3 ex-spouses collecting off my record. Or vice versa, if I wanted to collect an ex-spousal benefit off one of their records, I don't get all 3. I just get 50% of whoever had the highest benefit amount that I'm eligible for, okay? But once again, greater of your benefit or 50% of your ex-spouse's benefit. If you get remarried, you lose the ability to collect that divorced spouse benefit. Okay, survivor benefits. So if you are married and your spouse passes away, you can collect the greater of your benefit or 100% of your deceased spouse's benefit. Okay, instead of 50, now it's 100. Okay, so let's take a look at the example there. So Chris and Julie are married, both full retirement age. Chris's benefit's $2,000 a month and Julie's is $1,200. Chris passes away, Julie notifies Social Security. That's important. They're not going to come to you and let you know you're eligible for the survivor benefit, okay? You go to them, Julie notifies Social Security, and her $1,200 benefit is replaced by her $2,000 survivor benefit. So she's just going to get 100% of Chris's benefit amount. She doesn't get both, okay? A couple things about the survivor benefit. So age 60 is the earliest that you can begin collecting a survivor benefit. not 62. But once again, each year you take it early, it's going to be discounted roughly 7% per year, okay? Also, there are no delayed retirement credits if you are going to collect a survivor benefit, so it will not continue to increase past your full retirement age. Also, what we see is that earnings test still applies, okay? So if you're going to collect a survivor benefit before your full retirement age and you are working, once again, you cannot earn more than that $1,520 per month, or they're going to withhold a portion of your survivor benefit, okay? With survivor benefits, one strategy that we'll often see couples use is an individual with a higher Social Security benefit amount will let theirs grow until age 70, so that way if they were to pass away, the surviving spouse can collect 100% of that increased benefit amount. So it acts as a little bit of insurance, okay? So something to keep in mind there. One thing to note, if you see here on the bottom, the bold slide, divorced spouse survivor benefits are also available. So if you were married for at least 10 consecutive years and your ex-spouse passes away, you can collect the greater of your benefit or 100% of their benefit, okay? If you get remarried after age 60, you can continue to collect that divorced spouse survivor benefit. If you remarry before age 60, you lose the ability to collect that benefit. So we actually had a client one time who was 59 and a half, who they were able to collect an ex-spousal survivor benefit from, but she got remarried at 59 and a half. And so if she would have just waited 6 more months, she would have been able to collect an additional $2,000 per month off of her ex-spouse's record. So our actual recommendation to her was to temporarily get divorced for 6 months, start up her Social Security survivor benefit off her ex-spouse's record, and then get remarried to her current partner, and she would have been able, in the eyes of Social Security, to begin collecting that benefit, okay? But my point with this slide is, if this does apply to you, wait to get remarried until after age 60, more than likely, okay? Okay, dependent benefits. So we have a client at Haran who is 67 and collecting Social Security, and he is about to have his 7th child, okay? So his child is eligible to collect 50% of his Social Security retirement benefit through age 18, or 75% of his benefit if he were to pass away. Typically what we see happen is you might have legally adopted a child, okay? They're also eligible for dependent benefits. So we're going to take a look at this example. Same as last time, Chris and Julie are married, both full retirement age, except now they adopted a child, Johnny, who's 15. Chris's benefit's $2,000 a month and Julie's is $1,200. Chris passes away, Julie notifies Social Security, and her $1,200 is replaced by her 100% survivor benefit. So she's going to get Chris's $2,000, except now because they also have a child who is under age 18, Johnny can collect 75% of Chris's benefit amount and get $1,500 a month. If Chris was collecting his retirement benefit before he passed away, Johnny could have been collecting $1,000 a month while Chris was living, okay? But once again, children under age 18 are eligible to get a dependent benefit through age 18. All right, that brings me to our last complicated strategy. This one's called a restricted application. This one is getting phased out of the Social Security system. If you are eligible to do this strategy, I would encourage you to do it. I've seen this make the difference of roughly $100,000 over the course of someone's life, okay? But once again, I said this strategy is getting phased out. And so you can only do this if you or your spouse were born on or before January 1st of 1954, okay? So once again, you or your spouse had to have been born on or before January 1st of 1954. If you were eligible for the strategy called restricted application. With the way Social Security works now, under deemed filing rules, when you apply for your retirement benefit, if you are also eligible for a spousal benefit, you are applying for both of them at the same time, and you're just going to get the greater of the 2 benefits. You don't have the ability to separate your spousal benefit from your retirement benefit so that they work independently. What a restricted application allows you to do is restrict your Social Security application to just your spousal benefit. And what it's doing is it's allowing you to separate your retirement benefit from your spousal benefit. You're telling Social Security, I don't want to touch my personal retirement benefit. I only want to claim my spousal benefit. And so let's take a look at this example, and I think it'll make a little bit more sense. So Mike and Jane are 66. Mike was born before January 1st of 1954, and so Mike is eligible for $2,000 a month. Jane's eligible for $800. Instead of Mike starting his retirement benefit and Jane collecting a spousal benefit, Jane is just going to go ahead and apply for her retirement benefit. She's going to get $800 a month. Because Mike was born before January 1st of 1954, he is going to restrict his Social Security application to just his spousal benefit. So he's going to collect 50% of Jane's benefit amount. He's telling Social Security, I don't want to touch my retirement benefit of $2,000 a month. And so he's going to begin receiving $400 per month from Social Security at age 66, okay? In the meantime, his personal retirement benefit is going to continue to grow 8% per year until he turns age 70. And then once he turns age 70, he's going to flip from his spousal benefit to his increased retirement benefit and collect $26.40 per month. And now that he's collecting his retirement benefit, Jane can begin collecting her spousal benefit off of his record and get $1,000 a month, or half of Mike's PIA. Remember, PIA is what you are eligible to collect at your full retirement age. Spousal benefits are 50% of PIA, okay? So she's going to get $1,000 per month. But essentially what's happening here is Mike is just getting a free spousal benefit from age 66 till 70, and his personal retirement benefit is going to continue to grow 8% per year, okay? So once again, in order to do this, you had to have been born on or before January 1st of 1954. All right, that brings me to windfall elimination provision and government pension offset. So these apply to individuals who have a non-covered pension. What a non-covered pension is a pension that you are contributing to or another retirement system instead of Social Security. So once again, in Ohio, the most common ones are the Ohio Public Employee Retirement System and the State Teacher Retirement System. And so if you or your spouse does have one of these pensions that they were contributing to instead of Social Security, that could negatively impact some of those strategies I talked about. So we're going to review these two so that you understand those impacts. So what windfall elimination provision, this applies to individuals who have both Social Security and a non-covered pension, okay? So the way this works is Social Security is going to look at how many years you contributed to Social Security. If you contributed to Social Security for more than 30 years, there is no windfall on your benefit. You will get your full pension and your full Social Security retirement benefit, okay? If you contributed to Social Security for less than 20 years, the most that they can withhold from your benefit is $480 per month. And you don't find out about this, okay? It's not on your statement anywhere. You don't find out about this until you actually apply for your benefit and you let them know that you had a non-covered pension, okay? But once again, so the way this works is if you have more than 30 years contributing to Social Security, there's no windfall, you get your full benefits. If you contributed for less than 20 years, you will get a $480 roughly deduction from your benefit amount. So what you need to do is open your statement up to page 3 and count how many years you contributed to Social Security, and then deduct the corresponding amount from this table, and that will give you a rough idea of what windfall you can expect from your benefit. Okay. So with the windfall elimination provision, you will always get something from your Social Security retirement benefit. It will just be reduced, okay? So go through, count up your years of earnings. If you contributed to Social Security for less than 30 years, deduct that corresponding amount, okay? All right, that brings me to government pension offset. So unlike windfall elimination, which apply to individuals with both Social Security and a non-covered pension, government pension offset applies to individuals who just have a non-covered pension and want to try to apply for a spousal benefit or a survivor benefit off someone else's record. Okay? What Social Security is going to do is they're going to say, hold up, you have this non-covered pension, you never contributed to Social Security, and you're trying to apply for someone off of someone else's record. And so we are going to take 2/3 of your non-covered pension amount, subtract it from whatever you would have received from Social Security, and if that ends up being 0, then it's 0. So be it. You're not going to get anything from Social Security. Okay? So windfall, you'll always get something. It will just be reduced because you were contributing to Social Security. Government pension offset, you're trying to apply off someone else's record. This can reduce your benefit to 0. Okay? So let's take a look at this example. I think it might make a little bit more sense. So John and Jane are married. Jane has a non-covered pension. We're going to say the Ohio Public Employee Retirement System of $3,000 a month. John has a Social Security benefit of $2,000 a month. John passes, and Jane's going to try and apply for her survivor benefit and get 100% of John's Social Security benefit. Social Security Administration is going to say, hold up, you have this non-covered pension, and so you are subject to government pension offset. So they are going to take 2/3 of her non-covered pension, so 2/3 of $3,000 is $2,000, and subtract it from whatever she would have received from Social Security. In this case, a $2,000 survivor benefit. So 2,000 minus 2,000 is 0. She is not going to get anything from Social Security. She will only have her non-covered pension in the case of John's passing. And so that strategy I talked about before in survivor benefits, where one person might wait until age 70 to begin collecting, if you have a non-covered pension as the surviving spouse, that strategy might not make sense anymore. So really what these two strategies come down to are the actual numbers of the non-covered pension and the Social Security benefits. So if you have questions on calculating those benefits, there are online calculators that you can use on the Social Security website, or once again, we're happy to sit down with you and help you figure out what the impact would be. All right, we're getting towards the end here. Only a few more slides to get through. So Social Security and taxes. So I'd like to bring this slide up because when you apply for your Social Security benefit, the Social Security Administration does not ask if you would like to withhold anything for taxes. And so make sure to tell them, yes, I would like to withhold something for tax, because your Social Security retirement benefits and your spousal benefits, all of them are subject to income tax, okay? And the amount that you pay in tax is based off of something called provisional income. And so provisional income is all of your income excluding Social Security, plus 1/2 of your Social Security benefit, plus tax-exempt interest. Okay, I don't know how the IRS comes up with this stuff, okay? But if your provisional income for a couple married filing jointly is over $44,000, up to 85% of your Social Security benefit is subject to income tax, okay? What that means is 15% of your benefit is tax-free. The other 85% you pay income tax on, okay? For most retirees, it's 10 to 12%. So when you apply for your benefit, make sure to tell them you would like to withhold something for tax, so come April of next year, you don't end up owing a tax bill. You can choose between 7, 10, 12, or 22% for income tax withholding. And you can change it at any time. It's a simple form you fill out. It's called a Form W-4V. When it comes to state and local tax, there is no state or local tax on your Social Security benefits in Ohio, Kentucky, or Indiana. If you live outside one of these states, double check your state's tax rules. Or if you're planning on moving to a different state, once again, double check your state's tax rules. Some states do tax a portion, if not all, of Social Security benefits. All right, so you figured out what kind of strategy you want to apply for. You figured out what type of tax withholding you want to do. The last step is to actually go ahead and apply for your Social Security. And so you have 3 ways of doing this. The earliest you can apply for your benefit is 3 months before you want to begin collecting. Okay, so you have 3 options. You can either 1, visit your local Social Security office. Okay, 2, you can call and schedule a phone appointment. There's the 1-800 number. we encourage you to call at 7 a.m. to avoid the wait on those phones. Or 3, and we help people do this all the time, file for your benefits online. Okay? It takes about 30 minutes. It's pretty straightforward, the questions that they ask you. And the one thing to note about filing online benefits is that you cannot file for survivor benefits this way. So you do have to call the local office or visit your local office in order to file for a survivor benefit. Okay? All right, and when planning for your Social Security, just know that your checks are always paid a month in arrears. Okay, so if you want your benefit to start in April, you would begin the application in January, and then your benefit would begin in April, and you will receive your first check in May. Okay, and so once again, it is always paid a month in arrears, and so you will always receive your check on a Wednesday, but the Wednesday that you receive your check on is based off of the day of the month that you were born. So if you were born the 1st through the 10th, you will receive your check the 2nd Wednesday of the following month. The 11th through the 20th, you will receive your check the 3rd Wednesday, and the 21st through the 31st, you will receive your check the 4th Wednesday. All right, something new in Social Security this year. Actually, I think it was 2018 they started really pushing this. But it is designating in advance a representative payee for your Social Security benefit. And so Social Security does not recognize legal financial powers of attorney. So if you were to become mentally incompetent and your family member has a financial power of attorney to make decisions for you on your behalf in regards to your money, Social Security does not recognize this document. And so you need to go online and log into your account and scroll to the bottom and list up to 3 individuals who can help manage your Social Security benefits for you if you were to become mentally incompetent, okay? So everyone, after today's call, please log online and go through and name up to 3 folks who can make decisions on your behalf. All right, last slide here. So Social Security and retirement. I meet with a lot of retirees, and I think the biggest question I tend to get is, Mike, I'm planning on retiring, but I want to know how much money can I live off of in retirement without running out of money? Okay, all retirement is do I have more money coming in every month than going out? And so this is the way that you can figure this out. What you're going to do is you're going to add up all of your investment accounts, okay? 401ks, IRAs, 403bs, etc. Add them all up into one big pot. We're going to call it $100,000 for easy math, okay? So a typical conservative retiree investment portfolio should make around 4 to 5% per year on average, okay? So the whole idea is you make 4 to 5% per year, and you take 4 to 5% per year. So your accounts kind of stay the same over time. And so if you have $100,000 and you make 5%, that's $5,000 per year that you can take from your investment accounts, or roughly $440 per month or so, okay? So you have $440 per month that you can take from your investments. You have your monthly Social Security benefit, any monthly pensions you might be eligible for, and any monthly annuities. And that's how much income you have coming in every single month. So that when you're planning for expenses around retirement, try to keep it under that threshold, okay? But those are the sorts of things that we help individuals figure out. So if you have questions about your retirement planning, please let us know. Once again, we're always happy to help out, and we do not charge to sit down and talk with you about your planning. So with that being said, hopefully everyone took away a few things from today's seminar. I'm going to hand it off to Nate now, who will talk about Medicare for the next 45, 50 minutes or so. But there's my contact information. Once again, please don't hesitate to reach out. We're always happy to help. So thank you everyone for your time today. I'm going to stick around, so if you have any questions that you want to send in the Q&A chat, I will be happy to answer those for you. So thank you again.
All right. Great job, Mike, as always. Great information. Welcome, everybody. My name is Nate Epp. I'm a licensed agent here at Haran, and we will jump right in here with Medicare. And before we jump in, actually, I just wanted to mention a couple things. Mike mentioned this already before, but you know, this is a ton of information just thrown at you all at once. So we will be sending the copies of the presentations through email once we're done, but you know, don't put a lot of pressure on yourself to make sure you memorize everything here, have it all written down. Certainly take some notes, but you know, just know that you have a resource here at Haran. It's not just myself. We have a team of folks here that specialize in Medicare, and we're happy to help you. So how do we fit in the picture? I'm just going to mention this briefly, but I get this question a lot is, you know, what's your role into all this? So Haran, we are considered what they call an independent broker. So when folks come to us and they need our assistance, we're actually contracted with about 11 different insurance companies. So we look at what your needs are, prescription needs, doctor, hospital needs, your healthcare needs, and we do the research on all these different companies. We help you figure out of all the companies out there, which one really fits your needs the best. And what's in it for us is that when we assist you and help you get enrolled into a plan, that insurance company actually pays us a small commission because we stepped in and helped you out. And we actually are not allowed charging any fees at all on the Medicare side. So, you know, to get our help, it's no cost to you, and it does not impact the cost of your plan, the benefits of your plan, or what plans are available. So, all right, with that being said, we will jump in here. Brief history lesson here on Medicare. It started in 1965, and Medicare is designed for 3 groups of individuals. The first group, that's the group that we see the most often, are those who qualify for Medicare based on their age. So you're first eligible to start on Medicare the month that you turn 65. And it's actually the first of your birth month. So, you know, if your birthday is September 15th, you're eligible to start Medicare September 1st. It always goes back up to the first of your birth month that you turn 65. I always have a couple folks in the crowd that their birthday happens to fall on the first of the month. So if you are a first of the month birthday, you're actually eligible to start Medicare a month earlier. So if your birthday was September 1st, you would actually be eligible to start Medicare August 1st. That's the only kind of weird exception there. But otherwise, it's the first of your birth month is when you're first eligible. Second group of individuals, we have some clients in their 40s and 50s that are on Medicare. They're not 65 yet, and that is because they are on Social Security disability. Okay, so once you're on Social Security disability for 24 months, you are automatically enrolled in Medicare on your 25th month. Okay, so that happens automatically. So on disability for 2 years, you qualify for Medicare, regardless of your age. Third group of individuals, probably only get 1 or 2 of these a year, but again, this is of any age, those who are diagnosed with end-stage renal disease, permanent kidney failure, or ALS. Diagnosis of either of those conditions, and you qualify for Medicare. All right, those are your 3 groups, and Medicare has 4 parts. Parts A, B, C, and D. It's going to kind of feel like we're going through half the alphabet today, but just so you know about these 4 parts, we're going to do a little deep dive into each of these, but just so you know, the first 2 parts listed there, Part A and Part B, that's the government portion of Medicare. Okay, government is Part A and Part B. Every other part in Medicare, Medicare Advantage, which is also referred to as Part C, Medicare drug coverage, Part D, there's another product, it's not necessarily considered a part of Medicare, but Medicare supplements or Medigap plans. Those are all products sold by insurance companies. Okay, so there's basically a government component to this and then an insurance company component to this. And I'm going to kind of show you how it all fits together. All right. Before we jump into those parts, I've updated this slide quite a bit over the years, and I've kind of boiled it down to these top 3. These are the top 3 myths of Medicare that I hear just about every single day. So a lot of misconceptions out there. There's a lot of material floating around that doesn't provide the full picture. So these are the top 3 I've come up with, and hopefully this might clear up some confusion that you might have up to this point. The first myth of Medicare, a lot of folks believe that when you turn 65, you just automatically get Medicare. That actually is true for some people, but it's not true for everyone. Okay, so it is true for folks who start collecting Social Security prior to the age of 65. So if you start collecting Social Security early, let's say you start collecting at 62 or 63, 64, when you reach age 65, you are automatically enrolled in Medicare. Okay, but if you're not collecting Social Security, when you reach age 65, nothing happens. You're not going to be enrolled automatically. Okay, the only way that you would be enrolled into Medicare at 65 is if you actually filled out an application to get Medicare. Okay, so automatic for some, not for everybody. The second one here is, I mean, this is all day, every day. This is the biggest myth, in my opinion, in Medicare. And the myth is that you are required to sign up for Medicare at 65. So just like the first myth, the second myth, this rule applies to some people, but not everyone. Okay. So there are some exceptions, and here's basically what you need to know. Medicare says that if you have health insurance coverage through your employer, and as long as that employer has 20 or more employees, then when you hit age 65, you are not required to sign up for Medicare. Okay, you're allowed to keep on working, you're allowed to stay on your health plan, and you do not have to enroll into Medicare at all. Okay, you're allowed to delay enrolling into Medicare until you're ready to come off that employer plan, and there's no penalty with that delay. Okay, so I'm talking to people right now that are retiring and they're around age 70, 68, 69, 70. They have not signed up for Medicare. They've been on an employer plan this whole time, and they're completely fine. They're not going to get hit with a penalty. Okay, so and that rule also applies to spouses. Okay, so if you have a spouse on your plan, same rule applies. They do not have to sign up for Medicare at age 65. Now, you might hear the advice, I hear people tell me this, is that some people are under the impression that you should at least sign up for Part A of Medicare. Okay, so Part A of Medicare, if you sign up for that, there is no monthly cost to Part A, and it will act as a secondary insurance plan to your employer plan for any hospital-related expenses. Okay, now whether you should sign up for Part A or not actually leads me to the third myth here, and it talks about HSAs. Okay, so my advice to you, whether you should sign up for Part A or not, when you hit 65, it depends on what type of employer plan that you have. So if you have an HSA, a health savings account plan through your employer, my advice is do not sign up for Part A of Medicare, and here's why. Okay, so the third myth here on the screen, the myth is that you can't contribute to your HSA after 65. Okay, so there are some exceptions here to the rule. So if you're on an employer plan, let's say you have an HSA right now, if you hit age 65, you are allowed to continue and contributing into that HSA as long as you do not sign up for Medicare. Okay, so remember the rule is that you don't have to sign up once you hit 65 as long as you have that employer coverage. So if you have an HSA and if you don't sign up for any part of Medicare, then you're allowed to continue putting money and contribute money into that health savings account. Okay, so if that's important to you, and if you're on one of those plans, do not sign up for Part A of Medicare. But what if you're not on an HSA? Let's say you're just on a regular traditional type plan that has copays for doctors and medications, no savings component at all. There is no issue at all with signing up for Part A. Okay, so again, Part A, no monthly cost, and it'll act as a secondary insurance plan to your employer plan for hospital expenses. All right, so those are the three most common myths here, and we'll move on to the next slide, and we'll jump into those four parts I mentioned at the beginning. All right, so this is the first part that you get through the government, Part A. So just like Social Security, you have to have basically 40 quarters of paying into Medicare taxes, which is approximately 10 years. So as long as you or your spouse, either one of you, have worked those 10 years or those 40 quarters, then there is no cost to Part A. Now, what rolls up under Part A? So under Part A, there are three main things. It's the inpatient hospital expenses, skilled nursing facility, or hospice. Now, one myth with Medicare actually is that Medicare covers all of your expenses. I hear that sometimes, and that is not the case. Okay, Medicare is designed to cover a portion of your expenses, leaving you responsible for a portion. Okay, so here's how it works. I'm going to go over this bullet point here that says how these services are covered under inpatient. So if you get admitted into the hospital, there is a deductible that you're responsible for. It's $1,408. Okay, that's your responsibility. Medicare will pay the rest. Okay, that's actually pretty good deductible, low deductible, and that's a pretty good coverage there. But the issue is now with this deductible, it is not a calendar year deductible that you're familiar with. Okay, this is not a January through December 12-month deductible. This is what they call a benefit period, and it resets every 60 days. So if you go into the hospital, you get admitted into the hospital, you owe the $1,400 deductible. If you get out of the hospital and if 60 days go by and you happen to go into the hospital again, you'll owe another $1,408. Okay, so there's a potential there. If you have a rough year and if you have multiple trips to the hospital, you could owe that deductible multiple times. Now, if you happen to be in the hospital for 60 days in a row, you'll not only owe the $1,400 deductible for that first 60 days, but now, starting on day 61, you are responsible for $352 copay for each day from that point on. And then hopefully you don't ever hit 91 days in a row. It doesn't happen often, but it certainly happens. But if you hit that, then they double it to $704 a day. Okay, that would be your responsibility if you had Medicare just by itself. Okay, so that's what I'm describing here. So if you had it just by itself, no other expenses, or no other insurance products, that's how that would work. So that's kind of what we preach here is the moral of the story with Medicare is that you don't want to have it by itself. You want to have some other product like an Advantage plan or a supplement plan or something in addition to Medicare to help cover some of these expenses. And I'll get into that here shortly. Okay, so that's Part A of Medicare. That's the first part that you get through the government. The second part is Part B. Okay, so as you're planning retirement and you're trying to figure out how much is Medicare going to cost, okay, what am I looking at here in terms of a monthly budget? This is the first dollar amount that you're going to write down, okay? So Part B comes with a monthly payment. It's $144.60, okay? If you're going through this with a spouse, that's per month, per person. Now, Part B, the premium for Part B could actually be higher, and it's based on your income. So what they do is whatever year you enroll into Part B, they're going to pull your tax return from 2 years ago. So like right now, I'm talking to people that are going on to Medicare in 2020. They're pulling their 2018 tax return, looking at their adjusted gross income, and then whatever that is, they could, if it's high, they will actually charge you more for Part B. There's actually there's like 6 different income brackets that you could potentially fall under. So I'm not going to go through that all, that specific today, but just keep in mind that based on your income, it could be higher than the 144. And that gets reviewed every single year, and they update it automatically every single year. So it's a rolling look back. So if you are in those higher brackets, you're not stuck there forever. Usually in retirement, your income goes lower than what it was when you're working, so you eventually will move your way down to the lower brackets. But for today's purposes, we'll just use the 144.60. Okay. Okay. So remember back on Part A, that's all of your inpatient hospital expenses. Under Part B, this is all of your outpatient related medical expenses. Okay. So outpatient related expenses, there's a lot that rolls up under Part B. So that is your primary care doctor, that's your specialist, that is ambulance, that's medical equipment, chemotherapy, lot of expenses, any kind of outpatient procedures basically all roll up under Part B. Now, just like Part A, Part B does not cover all the expenses. It covers a portion, and it leaves you responsible for a portion. Okay, so under this last main bullet point here, how these services are covered, I'm going to walk you through what it would look like if you had Medicare Part B just by itself. Okay, so any outpatient-related expenses, you are responsible for a very small deductible of $198. And now that actually is calendar year. So that's a January through December deductible. So once you cover the first $198 of your outpatient-related expenses, then for the rest of the year, Medicare covers 80% of those expenses. You cover 20. Okay, so 80%, that's a pretty large chunk that they're covering of your expenses, which is good. But the issue is that 20% that you're responsible for, there is no cap, there is no limit. So when you start thinking of those expenses that we just went over, you know, chemo, ambulance ride, specialist visits, outpatient procedures, your medical equipment, you're paying 20% of all those bills. Okay, there is no limit. So again, that is the purpose of having some type of insurance product, Advantage plan, supplement plan, which we'll get into here shortly. But they are designed to put caps to your expenses and what you're responsible for. Okay. But those are the two parts the government provides, Part A and Part B. All right, there we go, roadmap. All right, so when I have a sit-down session with someone for the first time and you know, I'm trying to give them a better understanding of how all this fits together. How does the government portion of Medicare, how does that work with the individual private insurance plans that are available? How does all that fit together, and what does that look like? So we use this roadmap to kind of help illustrate that. So I have some options. You see a blank space here at the bottom. I'm going to pull some options up here, but I first want to kind of talk a little bit more about A and B, just a couple things, okay? Remember, as we go through this roadmap, that the costs that we just talked about, Part A is no monthly cost, Part B is $144 a month or higher, depending on your income. But no matter what you do, no matter what insurance product you pick, Advantage or Supplement, you're always going to pay that Part B premium. Okay, so that's a constant payment no matter what you do. Also, too, when you are planning retirement and you're trying to figure out, you know, when do I start this? How early do I apply? It's very similar to Social Security in that you are allowed to apply once you're within a 90-day window of when you need it to start. Okay, so right now, like I'm talking to people that are trying to retire at the end of the year, and they need Medicare to start January 1st. Because their employer coverage is going to end at the end of December. So in order to get Medicare to start January 1st, they're allowed to apply once they're within a 90-day window of that date, which is October 1st. Okay, so anytime after October 1st, they can actually fill out an application for Medicare. Okay, they can go online and do that. Okay, so whatever date you're looking for, you know, I help a lot of teachers they retire in the middle of the year as of July 1st. So 90 days prior to that is April 1st. So that's their timeline. So whatever your timeline is, whatever your retirement date is, take it back 90 days, and that's the earliest that you can start the process of applying. Okay. So once you get signed up for Medicare and you get that established, then your next step is, what do you do when it comes to your insurance plan? So you have two main options here. You have Medicare Advantage or Medicare Supplement. Sometimes you'll hear the term Medigap. We use the term Medicare Supplement, but Supplement, Medigap, same thing. It's the same terminology for the same product. Part C of Medicare, that is a Medicare Advantage, so sometimes you'll hear it referred to as Advantage or Part C. We just say Advantage here, but same thing there. So this is kind of the bulk of the presentation is right here. Once we get through this, we got just a few more slides, but this is really what it all boils down to, is going with either an Advantage or Supplement. Okay, so here's how it works. On an Advantage plan, okay, so what's really attractive about an Advantage plan is the monthly premium. A lot of these Advantage plans have no monthly payment. Okay, they're $0 per month. So if you're anywhere near 65 right now, you're getting bombarded in the mail and phone calls and emails and all that. But a lot of the junk mail that you get, little flyers, they'll have a big $0 sign. You know, it says $0 per month for this particular plan. That's what they're trying to sell you. They're trying to sell you a Medicare Advantage plan. So that's a really attractive part of that plan. But with both sides here, you have a trade-off. Okay, the trade-off here is that what you do pay for are your medical expenses at the time that they occur. Okay, so but you pay for them in the form of a copay or a small percentage. So, for example, you know, your Medicare Advantage plan might tell you that, you know, if you go to the primary care doctor, that it's a $5 or $10 copay. If you see a specialist, it's a $40 copay. If you go to the emergency room, it might be a $90 copay. A day in the hospital could be $300 copay. So, you know, every medical expense has some type of flat dollar amount or a small percentage that you're paying for that service. So just like the health plan that you have now, you have what they call an out-of-pocket maximum. So like on your plan now, there is a limit to how much you are responsible for in a year, okay? Same thing on these Advantage plans. So you're going to pay copays for all of your medical expenses or small percentages, and then if what you end up spending hits that limit, then you're covered 100% for the rest of the year, okay? Now those limits are going to vary from company to company, but most of them are right around $5,000. Okay, some are less, some are more, and that would be, you know, per person. So if you're going through this with a spouse, each of you have your own Advantage plan. Each of you have your own separate maximum. Okay, so no monthly payment. You pay as you go in the form of copay for all of your doctors and hospital or medical expenses, and then if you hit, you know, $5,000 roughly in medical expenses, then you're covered 100%. Now the drug coverage of Medicare, that's called Part D. D is in drugs. Part D of Medicare, that that's included in a lot of these Advantage plans. So you have copays for prescriptions built into that plan that you don't, you know, there is no extra charge for having drug coverage on your plan. So they combine hospital, doctor, and pharmacy copays all into one kind of bundled plan for no monthly payment. Now, one interesting aspect of an Advantage plan is that these insurance companies, when you sign up for this Advantage plan, you're signing up through some insurance company, you know, whichever one it is. It actually replaces the government portion of Medicare. So you're not actually using your Medicare card when you go to the doctor or hospital or pharmacy. You're using the insurance company's Medicare Advantage card, okay? That is your only source of insurance. You still have to stay enrolled in Medicare A and B, but you're not actually using it. You're using this insurance company as your only source of insurance. So because it replaces it, you have to make sure that you're staying in that insurance company's network. Okay, so whatever insurance company you sign up for, you got to make sure you're staying in their networks. That's part of my job, is that when you know, when you're interested, or if you are interested in an Advantage plan, I'll ask you to provide a list of any doctors or hospitals that are really important to you that you want to make sure are in network. We research all those insurance companies and figure out which company provides the best match. You know, which one has all of your providers in the network, which ones do not. Obviously, we want to recommend the plan that has all of your providers in it. So that's an important part of shopping and comparing Advantage plans. All right, there's an enrollment date there at the bottom. I'll get to that here in just a moment. Okay, but let's switch gears now and let's look at the other side of the roadmap at Medicare Supplement. Okay, it is pretty much an exact opposite of what I just went over for an Advantage plan, almost in every way. So the concept with a supplement plan is that you pay a higher monthly payment, but you pay very little out of your pocket in medical expenses. Okay. Right now, there are, for people who are turning 65 from this point on, there are 8 different Medicare supplement plans that you get to choose from. I'm not going to go over all 8, but I'll tell you about one in particular called Plan G. G is in giraffe. So under Plan G, you have a very small deductible that you are responsible for. And if we go back here and we look at Part B, the only thing you're responsible for when you have a Supplement G is this $198 deductible for the year, and that's it. So it covers that entire 20% that Part B leaves you responsible for, and it covers all of these medical expenses 100%. Okay, so if you sign up for this supplement plan G, your only out-of-pocket expenses is $198 deductible for the year. Now, that comes with a monthly payment, right? So it's not zero like the Advantage plan, and the payment is based off of age and gender and where you live. Okay, so and the older you get, the more expensive it is. So for someone who's 65 right now, you're looking right around like 110 to 120 a month for a supplement plan, that plan G. And again, that's in addition to what you're paying for Part B at the 144. Okay, so you have a higher monthly payment. Let's just call it 115, but you have a very small out-of-pocket of $198 for the year. All right, now the drug coverage of Medicare, Part D, it is not included in any supplement plan. So that's why you see a plus sign here, and there is a separate Part D drug plan that you have to buy. Okay, so they split your medical benefits and your prescription benefits into two separate plans. So you have a monthly payment here, and then you have a monthly payment over here for Part D. And Part D plans are usually, most people are between $15 and $20 a month for a drug plan. There's a lot to choose from. There's 20-some different drug plans that you get to choose from. And again, that's part of my role in all this is, I'll ask you for a list of your medications, and then we have a software that we can plug in your medications, and it'll show us which drug plan covers your medications the best. And so we'll make a recommendation based on that. All right, so remember back over here on Advantage is that you have to make sure that you're staying in the insurance company's network on an Advantage. You do not have to worry about that on the supplement. That is not how that works, okay? When you enroll into a supplement plan, it does not replace Medicare. The name kind of says what it does. It supplements Medicare, okay? So what happens is that when you enroll into this, Medicare is considered your primary insurance. The supplement is considered secondary. So when it comes to your network of doctors and hospitals, it doesn't matter what insurance company you pick. That is not who determines your network. The network, since Medicare is your primary, is Medicare. So you can actually see any doctor in any hospital or facility in the entire United States. As long as they accept Medicare, then your supplement will cover the expense, minus the $198 deductible. Okay? So a lot of freedom here when it comes to networks of providers, nationwide access, Advantage plans. Since it is through an insurance company, you do have to be careful and make sure that wherever you're going, it's in network for that particular company. All right, there is a very important rule that you need to know about enrolling into these plans. Is that one misunderstanding that I hear frequently is that you can switch freely to any plan you want during open enrollment. That's not necessarily the case, okay? So specifically with Medicare supplement plans. So remember this rule. When you first get signed up for Part B of Medicare, okay, they go by the date you start B, not Part A. They go by the date you enroll into B. You have a 6-month window from that date where you can pick any supplement plan through any company that you want, and it is guaranteed. It does not matter if you're healthy, if you're sick at all. They're not allowed asking health questions. You get a guaranteed enrollment. All right? That only lasts 6 months, all right, from when you start Part B. Once that 6 months is over, if you want to sign up for a supplement plan at that point, you do have to qualify based on your health. So let's say you start out with an Advantage plan, and then let's say a couple years go by, and then you decide, you know what, kind of feel like I want to switch from an Advantage over to a supplement plan. I don't mind paying that higher premium to get a lower out-of-pocket. Okay, in order to do that, it has to be during the Medicare open enrollment period, October 15th through December 7th. You can request that switch. However, you will be asked a series of health questions. Okay, they're going to ask you, have you had a heart attack or stroke or cancer, or have you been told by a doctor that you need to have surgery? What medications do you take? And, based on your health history, they're going to evaluate that and decide, yes, you're healthy enough, we'll take you, or no, your application's declined, you have to go back and just stay on your Advantage plan. You're not allowed to switch. Okay, so you can't just freely move around from plan to plan once you're past that 6-month window. You have to qualify based on your health if you want to move from Advantage to Supplement. Now, if you're on a supplement and you want to move to an Advantage, you can always move that way. That is guaranteed all the time. There are no health questions to move that way. So that's always a move you can make. It's just going back from Advantage to Supplement requires that health review. Okay, so be careful on that. I've seen people sign up not realizing that and then want to switch later and surprised that something just happened to them. They're diagnosed with something and they were surprised they couldn't switch over to a supplement. So keep that in mind as you make your decision. Now you'll notice this open enrollment date here under the drug plan. So if you do enroll into a supplement plan, that open enrollment date is not for your supplement plan, but it is for your drug plan. So you are allowed to freely switch to any drug plan you want during that open enrollment period. So that's part of my job too, is not only to help you make that initial switch over to Medicare, it's also to stay with you every year during open enrollment and help you evaluate your drug needs. Okay, so the drug plan that you start out with initially, 5 years from now may not be the drug plan that's best for you. Okay, so I always encourage everybody to review your drug plan every year during that open enrollment period and make sure you're on the right one based on what you need. Okay. All right, next slide here. So here's a super busy grid of all the different supplement plan options that you get to choose from. I'm not going to go over that grid with you, but I kind of highlighted 2 of them here, Plan G or Plan N. Those are by far the most popular supplement plans, and for good reason. Some of these other plans do not cover any skilled nursing facility, or they only cover half of your medical expenses or 75% of them. And there's some holes here that are not worth the lower monthly payment that they provide, in my opinion. So G and N, those are basically your top 2 supplement plans to check out. All right, a couple more slides to go, and this by far is, in my opinion, the most complicated part of Medicare is the drug coverage and how it's structured. So there's a term, I'm not sure if you heard of the term donut hole before, but if you have, and I'm going to kind of go through this with you so you understand kind of how the drug coverage works. So there are basically 4 stages of drug coverage, and it doesn't matter if you're on an Advantage plan or if you're on a separate Part D drug plan, no matter which option you pick, the drug coverage is structured the exact same, okay? So Medicare starts out, stage 1 here is your deductible stage, $435. Actually, not every plan has a deductible, okay? So it is excluded on some plans. They do have, insurance companies have some leeway here whether they want to apply that deductible or not. So you might have a deductible, you might not, but once you're through that deductible, or if you don't have a deductible, then you just go straight into this next stage called the initial coverage period. The best way to describe this period basically is that when you're in this, you're essentially paying copays for your medications. Okay, so when you go to the pharmacy and you pick up a medication, it might be a $5 copay for this drug. It might be a $20 copay for this other drug. You're paying copays for your medications. Okay. Now what's happening is that the insurance company and Medicare, they're actually keeping track of not only how much you're spending, but they're also keeping track of how much the insurance company is spending. So if you pay a $5 copay for a drug, the insurance company might be picking up $20 of that. Or more expensive drugs, say you're paying $50 for a medication, it might, the insurance company might be paying $100 of that. So they're keeping track of that grand total throughout the year. Okay. Now throughout the year, if your total cost for the year between you and the insurance company, if it ever reaches $4,020, you're now out of this initial coverage period stage, and now you've entered into the next stage called the coverage gap, also known as donut hole. Okay, so when you enter into this stage now, you no longer have copays for your medications. Those are gone, and now you're going to pay a percentage of your medications. That's 25%. Okay? So you're going to continue paying 25% of your medications until your total cost for the year between you and the insurance company reaches $6,350. If you ever hit that total, now you're out of the donut hole and you've hit the final stage of coverage where you're not going to pay any more than 5% of your medications. Now your costs go way down. Okay, so crazy structure. I know it's terribly complicated, but your experience in all this has everything to do with how many medications you take, how expensive they are. Everybody is different. So part of my job is, when you give me a list of your medications, I'll plug them in. The software we have, I can show you very easily if you're going to hit the donut hole, what month you're going to hit it, what your expenses are going to look like. It'll show me what month you're going to get out of it, what your expenses are going to be when you get out of it. Most people don't hit that amount, but if you do, I'm able to show you, and so you can be better prepared on what your expenses are going to be for that year. In red here, those numbers just came out for next year, so everything kind of ticks up a little bit for next year. All right, you guys had enough? Are you ready for a little bit more? Only got about 3 more slides to go, and we're all done. All right. So there are 2 main penalties to keep in mind in Medicare. Okay, it's the Part B penalty and Part D penalty. The Part B penalty is what I already mentioned at the very beginning, and Part B is simply as long as you have health coverage through your employer, and as long as it has more than 20 employees, no penalty at all on Part B. Okay, you can stay on your employer plan, no Part B penalty. The Part D penalty goes one step further, and it says that even though you have health coverage through your employer, that health coverage has to meet Medicare's standards. Okay, so Medicare has put together a standard level of prescription benefits. Like your plan has to basically meet this standard. It has to be good enough, basically, according to Medicare. And the term that they use is called creditable. Okay, so your plan at work has to be deemed creditable in order to not have to pay a Part D penalty later. All right. So if you don't know whether your plan is considered creditable or not, I would ask your benefit person at work, HR, someone who handles the benefits at work to ask if it's creditable or not. Employers should be notifying you every year during the employer open enrollment period. It's usually like a little piece of paper slipped in there. No one reads it, but in that benefit packet, it usually will indicate whether it's creditable or not. The majority of plans are creditable. There are very few out there that I've seen, but it's out there. So just be aware of whether something is creditable or not. So if it's not creditable, I'm not going to go through all the calculations and the strategies. We're going to run short on time in order to go through all that. But if you find out that your insurance through work is considered non-creditable, give me a call and I'll walk you through the strategies on how to avoid paying that penalty later. Okay. All right, moving on to the next slide. So HSAs. I have 2 more slides on HSAs. A couple little pieces of information you need to know, and then we're all done. Okay. All right, first bullet point at the top here, you have to keep in mind that when you draw Social Security after age 65, so at whatever point you do that, you will be automatically enrolled in Medicare. So Mike just talked about Social Security and all the different ages that you can start collecting Social Security. Just keep in mind that as soon as you start Social Security, you are automatically enrolled in Medicare. Why is that important? It is important because, remember the rule at the beginning is that if you are enrolled in Medicare, you can no longer put money into your HSA. Why this is all connected, I don't know, but it is. So just keep that in mind as you're planning on drawing Social Security. If contributing to your HSA is important to you and you want to keep doing that, that might be a conversation to have with your financial planner to see which one's most advantageous. You know, should you keep contributing into your HSA or draw Social Security? Unfortunately, you can't do both. All right. So you have money sitting into that HSA. Once you hit age 65, if you want to take that out and use it for something other than a medical expense, if you want to, you know, buy a hot tub or go on vacation or something with that money, you can do that, and there's no penalty any longer. However, you still have to pay taxes on it. It's taxable if you use it for something other than a qualified medical expense. All right, so the blue box in the middle, for single and for family, that's the maximum amount you can contribute into that HSA each year. Family is just 2 or more. You can add $1,000 to each of those columns, so $4,550 or $8,100 if you're over age 55. And then next year for 2021, they're bumping this one up, the single $50 and the family $100. Okay, so that's the most that you can contribute into your HSA. Whoops. Wrong button. Okay, bottom bullet point. So remember this rule I've been harping on about, you know, you enrolling into Part A and you can't contribute to your HSA once you do that. That rule only applies to you as the employee. It does not apply to your spouse. Okay, so let's say you and your spouse are on your employer plan. Your spouse turns 66 or hits their full retirement age and they want to draw Social Security. They can do that. They'll get enrolled into Medicare, and that actually does not impact your HSA. Okay, the spouse, they don't look at the spouse. They just look at you as the employee. Are you enrolled in Medicare or not? Okay, no worries about the spouse. Keep that in mind. All right, next slide. Wrap this up. So why is this HSA important when it comes to Medicare? So once you leave your employer and you go on to Medicare, if you have any money left in that HSA account, you can now use that money to pay pretty much every expense in Medicare, including your premiums. You can pay your Part B premium, you can pay your drug plan premium. There are some Medicare Advantage plans that do charge a premium. You can use that money to pay that premium. Any deductibles or co-pays, you can use that money for. The only thing you cannot use it for is your Medicare supplement premium. I don't know why, but you just can't do it. But everything else you can. So, you know, I would strongly encourage you, if you're on one, put as much money in that as you're able to. It goes in tax-free, it comes out tax-free, and in retirement you can use it, you know, to help pay your Medicare premiums. So, very useful account if you can take advantage of it. Okay, last really goofy rule in Medicare that you need to be aware of, and then we're all done. Okay, so this applies to you. It's not when you're turning 65, but this applies to you when you have delayed Medicare until a later date. So let's say you wait till 67, 68, you know, you wait till a later age to apply for Medicare. What will happen is that when you apply for Medicare Part A and Part B, they're going to start Part B of Medicare on whatever day that you tell them that you need it to start, okay? However, Part A, they're going to automatically, retroactively start Part A back 6 months. So like right now, I'm talking to people that are retiring at the end of the year. They're going to apply for Medicare to start January 1st, A and B. But Part A is going to go all the way back to July 1st. Why do they do that? Well, the best I've read on this is that it was intended as a benefit. They will retroactively help cover any hospital-related expenses you had going back 6 months. So it could potentially help you. If you didn't have any hospital expenses in the last 6 months, then it will not. But remember, the rule is that if you're enrolled into Part A of Medicare or any part of Medicare, you can't put money into your HSA. Well, because they take it all the way back 6 months, that means you have to stop contributing to your HSA 6 months before you plan on signing up for Medicare. Go figure, that one. So as you're planning this stuff, that's part of my job too, is to, you know, as you're planning retirement, if you have a date in mind, give me a call and we'll put a timeline together. You know, I'll help you to say, okay, as of this date, make sure you stop this, make sure you apply at this time. kind of help you put some structure together on your timeline. So if you can stop your HSA contribution 6 months before you retire, that'd be great. Not everyone has the luxury of planning that far ahead. Sometimes things happen suddenly, and you don't have the luxury of planning 6 months ahead. So what happens? So any money that's been contributed in that 6-month window is now subject to tax. It's not tax sheltered anymore. So when you go do your taxes, they consider that an excess contribution. So it's not the end of the world, but you'll have to pay taxes not on the total amount, but just on what was contributed during that 6-month window. And IRS considers that an excess contribution. They tack another 6% penalty on that as well. So you can work with your employer to reverse those funds as long as they're still there, and you can avoid that penalty. But just something to be aware of as you're planning retirement. All right, that is the end. So the last page here is just a list of a lot of different resources. There's my information. I have a colleague in my office, Heather Ballou. It's her information as well. Her and I also specialize in insurance for people who are not yet 65 and they don't have coverage through their employer. They need to find their own individual health plan. We help with that as well. There's also a link here to our Horan's website, where if you want a quote on a Medicare plan, you click on that link, and there's a form that you can fill out to enter in your doctor and prescription information, and that'll get emailed to us, and we'll get to work on researching some options for you. But that concludes the presentation today. I think we're just a minute over. Let me check the questions here and see if we have any. If not, you all are welcome to disconnect, and we appreciate your attendance, and thank you so much for hanging on. Stay in touch if you need anything. But I'm going to go through the Q&A here and see if I can answer any questions. Otherwise, you're free to go. Thanks for joining.